you can the same level show you that this is the knee level. So from this position, he must recommended to the cut amputation at the university, but fortunately he came back to my clinic to treat the heredity, and then he can get this condition. He is now still his leg alive, 13 years old after treatment, still alive today. This is foot rebel. This is the lumbago cases before and after, about 7 minutes after. This is atopic dermatitis cases, 3 months after. This was the hypertrophic cases. No, we need not use any drugs or ointment. This is before and 1 year and 6 months later and 3 years later. The hypertrophicness here also appears, but all of these hypertrophicness getting retarded, removed. And this condition cases, we usually cut these kind of hypertrophic condition in case of the plastic surgical technology. But when we use LLT, we can get this condition. We need not cut it, the hypertrophic condition. This is the vitiligo cases before and after 6 months later. This case is 23 years he treated by Puba method, but unfortunately they cannot give any pigment onto the vitiligo face. But we can give this condition only 4 months. This is the acute type of the muscle pain. We can give twice treatment this condition. In this case, he is a professional pitcher, but he can throw only 30 minutes before treatment. But twice treatment after, he can come to the play game, and he became the winner 4 days after treatment. Only twice treatment. This is yes, the acute pain of the knee. This case is the Royal Hospital of England. I treated this patient. 7 minutes later, we can get this condition. She came in with stitches, but she came out without stitches. Only 7 minutes. This is a chronic type of pain cases. We treated this patient 3 times. They have cases the elbow dullness and the stomach ache and menstruation irregularity. But all of these symptoms removed by laser treatment. This is also the Royal Hospital cases. He was, this is the frozen shoulder cases. 5 years old frozen shoulder. Very difficult to treat it. But only 20 minutes we can give this condition. Hold on. This is the rheumatic arthritis cases. Yes, we can give this condition soon after treatment. This patient, lumbago, very severe lumbago, came in with stitches, came out without stitches, about 5 minutes later. This is facial Paulding's cases. 10 times of treatment and 3 months later, we can get this condition before and after. The same patient. See, he cannot close his eyes. He can close eyes. This is fertilized ovum cases. This is before the LLT, the patient fertilized ovum like this. But after LLT, we can give this condition, the same separation in the cell. It become good. We can give birth to happy delivery to her. These are laser babies. We have now, in my clinic cases, 74 laser babies in my clinic. This is the cerebral blood flow change with LLT checked by SPECT. This is before LLT, this is post LLT. And we can give this condition and the brain cerebral blood flow increase, and this is right basal nucleus zone compared to this one, 36% increase. And posterior zone, we can give 35% increase. And this is the same patient. These catheter zone all increase with blood circulation. And so, if we can give this kind of scattering pattern and these kind of parameters, wavelength, power density, radiation time, radiation area, radiated area, and laser device, and penetration depth. These are just like the formula of chemical formula. So if we can use this kind of scattering pattern and parameters, we can compare the result of the laser easily. So the helium neon, this one case is helium neon radiation cases. We can give this condition as we can give it ACLT. If we use the same laser to the occipital point and the parietal point for the treatment of headache, to the same lasers to the different point, we can call this same reactive homo-simultaneous CBL, combined laser treatment, CBLT. In this case, different reactive homo-simultaneous CBLT. We can treat hemangium simplex using CO2 Ca apple carbonization apple, make a pinhole. Afterwards, when we irradiate, we use dye laser PV apple, and then we can give the deeper penetration level of laser treatment. So we call this DRHOSICBLT. This is another type of headache treatment cases. When open your mouth using the Henne laser cases, and this is treated occipital area, we can use the gallium aluminum argon laser cases. We call this same reactive xeno simultaneous. Xeno means different type of laser we can use, and same reaction. Open mouth, so we can treat the pharynx using this Henne laser. And this case is different reactive xeno-simultaneous CBLT cases. Cavernous hemangium cases treated by cases. In this case, firstly, we make a shrinkage or hemostat. Hemostat case is vaporization using a CO2 laser, and then breathing appears, and then the defocus beam, we usually use the CO2 laser. But somehow the breathing is very strongly coming out cases. We can use the laser hemostat, tooth hemostat, more easily compared to the defocused CO2 laser. Sometimes. Or sometimes the shrinkage, we use the laser and then vaporize CO2 laser. This kind of treatment, the DRXC xeno simultaneous CBLT, we call, I named this one. Treatment of big tumor cases. The left side and right side. And if we want to treat in a short time, we can use 2 apples, 2 lasers, 2 same lasers. So the same reactive, successive, or the successive CBLT. We can call this like this. Now it's getting complicated, so I would like to stop these kind of things. And so anyway, the multiple laser treatment come to divided into combined LT and compound laser treatment. And concomitant one, the conventional treatment to make frac using CO2 laser or the conventional knife cases. And then afterwards, if there occurs pain, inflammation occurs cases, we can use Ca, aluminum arsenide, gallium arsenide diode laser for the treatment of heredity or inflammation. And we must consider using a heredity cases. Right brain controls the left side of the body, left brain controls the right side of the brain. And look at the homunculus draft of the brain